Go for it.
You are dispatched to a grocery store parking lot for a 58-year-old female experiencing chest pain.
Okay. So I arrive on scene. I put on my proper PPE precautions. Is my scene safe?
Yes.
It's my only patient?
Yes.
Okay. Dispatch didn't say she fell or anything, so we're not going to put a C call. We're going to call ALS, because I can always cancel them on the way. We move down to primary. So what do I see walking up?
Middle-aged female sitting on the floor near checkout lanes with bystanders around her, and she's appearing anxious with her hand on her chest.
Alright, so I walk up. Hello, I'm Tyson. I'm going to be your EMT today. What appears to be the problem?
My chest really hurts. It's crushing like someone's sitting on me.
Okay, so I'm going to move my ABCs. So can I see your open your mouth so I can see like if it's blocked or anything? Is it clear?
It's patent.
Okay. Then we're gonna check breathing. So I'm gonna listen.
Lung sounds are normal and equal.
Okay. And then we're gonna check the skin.
Skin is slightly pale and clammy.
And we're gonna check the circulation.
Radial pulse is strong and regular.
Okay. So then we're gonna move on to the OPQRST. So what were you doing when this happened?
It started suddenly while I was walking.
Suddenly you're walking. Okay. So okay. Then does anything make it worse or better?
Walking made it worse. It hasn't gotten any better, but sitting doesn't make it worse.
Okay. Does it like what does it like feel like to you specifically?
It feels like a pressure, like something's sitting on me or squeezing me.
Okay. On a scale of 1 to 10, how bad?
8 out of 10.
8 out of 10. Okay. And we're gonna move down to the sample. So you already said you're with the crushing pain and stuff, right? Do you have any allergies?
No.
Okay. Do you take any medicine?
I recently started lisinopril.
What is that?
It's for hypertension.
Hypertension. So, okay. Do you have a history of any kind of diseases or anything?
I have high blood pressure, and my doctor's watching my cholesterol and blood sugar, but I've never had these symptoms before.
Okay. When's the last time you had food?
I had a light breakfast a couple hours ago.
Does it radiate anywhere?
It goes into my left shoulder and kind of up my jaw.
Okay. So possible heart attack. We're gonna do the transportation. That's a high priority right there. So for an intervention, we're gonna give 324 milligrams of aspirin, and then 0.4 nitroglycerin. We're gonna move on to my secondary assessment. So, do you feel dizzy at all or anything?
She feels dizzy while walking, but she's not dizzy now.
Okay. We're gonna listen to her lungs again.
Lung sounds are normal and equal.
Listen to her heart.
Sounds normal.
Sounds normal. Okay. Her skeletal check, I guess. You feel weak at all or anything?
No, the chest pain doesn't change with any movement or palpation of the chest either.
Okay. I guess we're gonna just load her up, and then we're gonna put her on high flow oxygen, and we're gonna head to the nearest trauma center. How close would that be?
15 minutes out.
15 minutes out. Okay. So we're gonna load her up, and then we're gonna do verbal report. So we had a 58-year-old woman who was experiencing chest pain. I administered 24 milligrams of aspirin and 0.4 milligrams of nitroglycerin. We put her on high flow oxygen, 10 liters, and rapid transport to trauma center.
Okay.